In the realm of healthcare, understanding and addressing patient needs are foundational elements of providing effective care coordination. Patients come from diverse backgrounds, each with unique medical, social, and behavioral factors influencing their health and well-being. As care managers, it's essential to comprehensively assess these needs to develop tailored care plans that promote positive health outcomes and enhance patient satisfaction. The first step in understanding patient needs is conducting a thorough assessment. This involves gathering information about the patient's medical history, current health status, social determinants of health or SDOH, and psychosocial factors. Care managers utilize various assessment tools, such as health questionnaires, interviews, and medical records to gather pertinent information. Key areas of need to focus on include: medical needs encompass the patient's physical health status, including chronic conditions, acute illnesses, and ongoing medical treatments. Care managers assess the severity and complexity of medical conditions, medication management, and adherence to treatment plans. Understanding the patient's medical needs allow care managers to coordinate appropriate healthcare services and interventions to address these concerns effectively. Social determinants of health refer to the social and economic factors that influence an individual's health outcomes. These factors include socioeconomic status, education level, access to healthcare, housing stability, food security, and social support networks. SDOH can significantly impact a patient's ability to manage their health effectively and access healthcare services. Care managers assess these factors to identify potential barriers to care and develop strategies to address them. Psychosocial factors encompass the patient's medical health status, emotional well-being, and social support systems. Care managers assess the patient's psychological needs, including stress levels, coping mechanisms, and mental health conditions such as depression or anxiety. Additionally, understanding the patient's social support networks, including family, friends, and community resources, is crucial for providing holistic care. Cultural considerations play a vital role in understanding patient needs. Cultural beliefs, values, and practices influence how patients perceive illness, seek healthcare, and make treatment decisions. Care managers must respect and accommodate cultural preferences and beliefs when developing care plans. Culturally competent care enhances patient trust, engagement, and satisfaction with healthcare services. Once patient needs have been assessed, care managers develop individualized care plans that address identified concerns and goals. Care plans are collaborative documents that outline specific interventions, goals, and outcomes tailored to meet the patient's unique needs. These plans incorporate medical treatments, social support services, behavioral interventions, and educational resources to support the patient's overall health and well-being. Continued monitoring and evaluation. Understanding patient needs is an ongoing process that requires continuous monitoring and evaluation. Care managers regularly assess the patient's progress, reassess needs as circumstances change, and modify care plans accordingly. Monitoring patient outcomes allow care managers to identify areas for improvement, adjust interventions, and optimize care delivery to achieve desired outcomes. Addressing health disparities. Understanding patient needs also involves addressing health disparities and inequities that may disproportionately affect certain populations. Health disparities refer to differences in health outcomes and access to healthcare services based on race, ethnicity, socioeconomic status, geographic location, or other factors. Care managers play a critical role in advocating for health equity and addressing systemic barriers to care to ensure all patients receive equitable and inclusive healthcare services. Empowering patients. Empowering patients to actively participate in their care is essential for achieving positive health outcomes. Care managers educate patients about their health conditions, treatment options, and self-management strategies. They encourage patients to set realistic goals, make informed decisions, and advocate for their healthcare needs. Empowered patients are better equipped to manage their health effectively and actively engage in the care coordination process. Collaborative care coordination. Understanding patient needs requires a collaborative approach involving healthcare providers, interdisciplinary teams, and community resources. Care managers collaborate with physicians, nurses, social workers, pharmacists, and other healthcare professionals to coordinate comprehensive care for patients. They also collaborate with community organizations, social service agencies, and advocacy groups to address social determinants of health and enhance patient support networks. Understanding patient needs is a foundational component of effective care coordination. By comprehensively assessing medical, social, and behavioral factors, care managers can develop individualized care plans that address patient concerns and promote positive health outcomes. Through ongoing monitoring, evaluation, and collaboration, care managers empower patients to actively participate in their care and advocate for their health needs. If you're interested in learning more about care management, you can find more information on our website at the links below. Please click like and subscribe. Thanks for watching.